I'd like to bring on our next guest, a associate with Marcia, talking about, again, Health Advocate is, a very integrated model to really serve consumers and employers. And Pam Mortenson is Executive Vice President of Wellness Solutions at Health Advocate, a subsidiary of West. Pam, good morning.
Good morning. Great to be here.
Yeah, great to have you on the program. Just had a great discussion with Marcia about transparency. Looking forward to this discussion about well-being.
Great. Fantastic.
Hey,
thank you.
You bet. Hey, Pam, give a little background on Health Advocate and your area of wellness, and then we'll kind of dive into this shift from wellness to well-being, if you don't mind.
Sure, absolutely. Well, as Marcia just said, Health Advocate is a subsidiary of West Corporation. We are the nation's leading healthcare advocacy and assistance company. We serve over 11,000 clients, some of the nation's largest companies here in the U.S. We provide advocacy services that really helps members navigate across really a very complex healthcare and insurance-related environment, saving both time and money for the employer and employee, of course. But, our services really are a suite of solutions that include wellness, EAP, work-life, chronic care solutions, and really among many, many other services. And we do offer an integrated program that really combines all of these services into a single kind of convenient member-centric solution. And that starts to really get into the well-being solution set that we'll talk about here today.
No, that's great. So talk first, before we jump into well-being, talk first about some of the challenges that you see in working with employers that they're currently facing with regards to their health care and benefits.
Sure, you bet. Well, I think we all probably see the trends out there. The medical health care costs are continuing to rise. And specifically from 2016 to 2017, we're hearing numbers that they're expected to increase on average between 6.5% to 8%, depending on the type of plan. Prescription drug costs are also trending on the increase as well. They're saying about 13% increase expected from 2016 to 17. Mostly that increase is coming from higher usage and then specialty drugs, of course. But also, even with 50% of the large to mid-size employers offering these high-deductible plan options, we've also heard trends that about 70% of those employers are still expecting their health care benefits budgets to increase in 2017. So a lot of concern there in the market around these health plan costs. I think the other two things that we see as challenges certainly our employers want to see employee bases have higher and better health and wellness across their populations. And they also, I think, would say that benefit programs that they're offering need to drive greater engagement that they believe will lead to healthier and more productive workforces.
I think it's also a key retention tool, is it not? As more and more
Absolutely.
companies compete for skilled workers. Skilled,
you bet. Retention is a big part of these well-being programs. You bet.
So talk about the shift from traditional wellness to well-being, and what is it and what's driving that?
Sure, you bet. Well, wellness programs have tended to really focus more on the physical part of it. So physical activities, walking, running, smoking cessation programs, nutritional counseling. Often there are incentives around those to incent employees to participate in those walks or runs and how many miles they're logging. But more organizations are starting to shift from just wellness to more well-being and really adopting a more holistic approach for that individual. So things that would be incorporated into a broader well-being program would be more enhanced programs, and they're really intended to meet the employee where they are in their life. And those programs would include things not just the physical wellness that I described, but also financial wellness, mental, emotional wellness, social community programs, and even professional work-life balance programs. And I think what we're finding is really creating a more personalized program, again, that meets the needs of where that employee is in their life.
You know, Pam, I was talking to Dee Eddington the other day on a call, and we talked about caring as a part of this. You know, and then mindfulness, which is going to be covered at our upcoming forum that we did that in May. I mean, all these are emerging as part of this well-being, correct? I mean, you bet, they absolutely are. And again, I think you've got to recognize these employee populations are very diverse. We've got baby boomers, millenniums, Gen Xers that are all in the workforce, and they all have different needs. You know, and certainly need to make sure that these employers are offering programs that really matter to the individual. Yeah, and you know, I know it sounds pretty simple to understand, but when you talk about financial wellness and how it's emerged, it just is common sense that you can't have somebody, you know, address healthy eating habits or healthy exercise habits if they're stressed out about their mortgage, right? Stressed out about their bills. You've got to help them address the financial part to even get the physical part, you know, doing what it should be doing. Correct?
That's absolutely true. And, you know, I think that's exactly what we're seeing. You know, there could be certainly a young adult who might be training for his first 5K, could be really experiencing a lot of stress related to maybe paying off student loans, for example. And they're going to be seeking, you know, very, very different resources from maybe a mother that's working, that's managing, you know, her chronic high blood pressure and maybe caring for aging parents. So very, very diverse needs, you know, with those two examples.
So give us an example, or talk a bit about how, you know, if employers are listening here, whether right now live or going to access this podcast, you know, how can they implement this program, and give examples of some best practices organizations can consider to help with this transition?
You bet. Well, I think certainly one you know, I guess a big part of our experience in working with so many employers across the nation is really, if you're starting out to develop a program for the first time, keep it simple. Start simple. Set one goal that's measurable for year one and learn from that across the employee population. I would also say another best practice would be to conduct biometric screenings, do a health risk assessment, and understand kind of the importance and what you get from that data across the entire population. And then really taking a look at the claims data, if assuming that most of the employers do have access to their claims data, what are the top three biggest claims costs? And I think if you can use those data points that I just mentioned, then you can really begin to construct a program. But there's probably some other best practices that should be also considered as you start to drive a well-being program. One is assess the health and culture, as I mentioned, and that's really, again, making sure you understand the organization workforce. And one way in which to do that would be to just do a simple survey across the employee base to really get a good grasp of the culture and the things that matter to that employee population. So that would be certainly one best practice. And I think, as I mentioned, selecting the right mix of a program. A one-size-fits-all program isn't necessarily going to meet the needs of every person in your population. So the right mix of services is going to be very key. And then communicating often, we find that to be a very solid best practice, helping employees continue to understand what those services are and how they can help them, and keeping that front and center. And I think we also find that communicating often isn't necessarily just sending out an email. It may mean a text message or an email, or it could be even an automated voice outreach that goes out. But I think those kinds of things, along with posters and materials that are sent, is very important to keeping that engagement up across the employee base. And then, another area would be incentives. And certainly incentives, I think, are really important to generate participation as you start with a well-being program. Typically, it's voluntary, but incentives are really an effective way to get employees involved. And certainly, there's a lot of rules and regs associated with offering incentives, so that's going to be important that an employer, understands those EEOC regs, and certainly those around the Health Insurance Portability Accountability Acts. All of that has to be, thought through.
Go ahead.
I'm sorry. Go ahead. I was just going to say, and then I think the other last point is really you've got to continue to evaluate your program, continue to get feedback, what's working, what's not working, and make adjustments as you go. I think that's, again, a critically important element to driving a successful well-being program.
When you and members of your team are out there working with employers across the spectrum of who Health Advocate works with, what are some of the hurdles that you and your team are working on to really get an employer's light bulb to go off and have kind of an aha moment like, okay, wow, I was just starting to get my arms around wellness. Now you're talking to me about well-being, so I'm a little overwhelmed.
Right. Again, I think continuing to communicate what these options are, what these services are, is an incredibly important element. Because if employees are not aware, then of course they're not taking advantage of those. So that's probably a hurdle that we see often. A lot of these employees don't even realize these services are available. So very, very important aspect of really enabling a well-being program across an employee population.
I agree with that. But even coming back to the beginning, is it getting the employers to see why they should do this? What are some of the things you and your team do to get kind of the employer to have that aha moment? Say, okay, wow, now I see where well-being is where I need to go with putting together a well-rounded well-being program.
Yeah, again, I think general wellness or physical wellness are always great places to start. But when you, again, start to really create a more personalized approach, there tends to be, greater productivity and even health cost reductions. If you're supporting a chronic care type of program, or maybe there's a particular part of your population that is going through, delivering babies. Those kinds of healthcare costs can get to be very expensive if someone ends up having a baby prematurely. We've got programs that can certainly help support and keep a particular pregnancy on track and hopefully help avoid some of those high costs. But those are the kinds of ROI paybacks and examples that we tend to show clients the importance around a broader well-being program, and not just focus on kind of the general activity, but other things that can get very personalized to an employee population to meet the needs of the individual.
Makes a lot of sense, Pam. So talk about, you've kind of talked about it throughout this segment, but talk a little bit more about how what you're doing at Health Advocate that's a unique approach to well-being.
Sure. I think, again, working with Health Advocate, we are able to really develop personalized programs. And we do that through both online as well as through live coaching programs. And we can do that to support anything, very simple in terms of programs to some of the most complex needs across an employee population. And because we offer such a full variety and full array of well-being programs and services, we really can address the whole person and really make it personalized to meet the needs of that employer's population, I should say. And I think having just one partner rather than multiple partners to create this well-being program does really provide a more cost-effective and more efficient way in pulling all of this together. And, I would say Health Advocate is really unique in that we've got trained coaches, nurses, clinicians, benefits experts that all come together to provide, not only that live expertise, but in combination with our technology tools. and really are designed to help get people engaged and helping them make better informed decisions about their health and staying on track toward a healthier lifestyle. But, again, I think that the clients that work with us really would say that we're able to help reduce those medical costs, really drive greater productivity and engagement across an employee base, and really bring about better health outcomes.
That's great. Pam, it's been great having you on the program. It's been a great discussion and look forward to continuing this sometime in the future. I'd like to give you a chance to leave our audience with a couple takeaways, too, if you would, please.
You bet. I think certainly, as I said, one of the key factors in developing a well-being program is to understand the employee culture and, what's going to be needed to meet those particular needs in a personalized way. And I think a well-being program and really making sure that you're addressing the holistic person will help drive greater engagement and hopefully retention and higher productivity. And again, I think Health Advocate is really well positioned to be really that right partner in providing that well-being package overall.
Pam, thank you so much. And if somebody's listening and wants to get in contact with you or find out more about what Health Advocate is doing around wellness, can you let them know how, please?
Sure. They can go to healthadvocate.com and go to our website, and there's contact information there, or they can certainly get in touch with me, and that's P.A. Mortenson, Mortenson, @west.com.
Thank you, Pam, so much for joining us today. You have a great Labor Day weekend, and we'll talk to you again soon.
Thank you. You do the same. Appreciate the opportunity. Bye-bye.